Hi, friends. Welcome to today's special episode of We Are Marketing Happy, a healthcare marketing podcast. I am Jenny Bristow. I am the CEO and founder of Hetty and Hop, a full service, fully healthcare marketing agency. And we have been really leading the way as far as publicly discussing OCR's December 2022 bulletin, the huge impact it had had on the way marketers in healthcare can really do their jobs. We also really been leaning in as far as all of the movement with the FTC for healthcare adjacent organizations, as well as a lot of state laws. We have episodes specifically dedicated to each of those topics, which we'll link to in the show notes. But, there aren't really many moments in healthcare where we really have the tea, right? Like, let's share the tea and talk about some gossip and some super controversial things, right? Like, we're healthcare marketers. It usually doesn't happen. Well, my team has really been digging into a lot of the publicly shared responses to OCR's bulletin. They actually put out an RFI. We want to hear from the public about your thoughts about our bulletin. And we had a client actually ask us to give our perspective on AHA's response, American Hospital Associations. And we actually had an in-person coffee session this morning, and it got heated with all of my team members. They were so frustrated at American Hospital Association's perspective and their position on the bulletin that I just felt so compelled to come on and actually share Hetty and Hop's stance. So let's back up a little bit. As most of you should know, the December 2022 bulletin effectively began categorizing IP addresses on the marketing front end of websites as PHI. So before, it was only once you were actively within, say, a patient portal, within an Epic instance, whatever, was the only time that marketers really had to think about HIPAA. This bulletin completely changed everything. All of the technologies that we knew, liked, and loved suddenly were no longer able to be used. Things like Google Analytics were no longer compliant. And there was a huge moment of panic, right? Like all of us, including us at Hetty and Hop, kind of stepped back and was like, well, now what do we do? What do we do now? If we can't use these things that all of these other organizations and companies in other industries are using to provide a great consumerization experience, how are we going to continue to serve patients in a positive way? So we had our little moment, our little pity party, but then we buckled down and we figured it out. And turns out it's not that hard. It's not that hard and it's not that expensive. So I want to step back and talk about this a little bit because myself and the rest of the team at Hetty and Hop strongly disagree with AHA's stance. Them saying, let me actually quote this. AHA recommends that Congress should consider exploring how to better require entities not covered by HIPAA to protect patient privacy, especially those third-party entities that decline to sign BA, and that they urge Congress to make clear to OCR that the agency should withdraw this guidance immediately, and that this part is separate. It is onerous and it is impossible for marketers to continue doing their jobs. Not only does this OCR rule violate HIPAA and its implications, but it inflicts meaningful harm on patients and public health. Congress should urge OCR to withdraw the rule immediately. Really? American Hospital Association? Really? Oh, I love when Zoom does that to me. I was not giving AHA a thumbs up, by the way. So ever since 2018, Congress has been fumbling its way through understanding how technology works, right? Like I remember whenever Zuckerberg was on stand and then all of these memes came out because basically it felt like all of these old people were asking Zuckerberg why their grandchildren weren't accepting their friend requests, right? Memes galore really showcase the questions they were asking, totally showed a lack of understanding about how the technology worked. That's scary, right? People that are legislating, not understanding what they are legislating is scary. But does that mean we're going to leave it to the technology companies to decide what information should be captured and stored? So we have been attending all of these healthcare conferences and we've really been going on a speaking tour. I spoke at Shushman. Next week I'm at Smash. We attended Becker's and talked with a lot of participants about it. And then I'm going to HCI. The list goes on and on, right? Because this is such a hot topic. Well, as a follow-up, we actually decided to audit all of the provider websites for those folks that were at Shushman. You would be astounded. Out of hundreds. I think there were over 450 provider groups there. Only 70 had removed scary tags. Vast majority of them had meta tags. Some of them had TikTok conversion tags. I'll tell you, if I'm searching for care, I've been very public about a lot of my healthcare stuff that's been happening beginning of this year. I've had to seek out and research lots of care. TikTok, knowing that I was doing that, Meta, knowing that I was doing that is terrifying. I guarantee they are not going to be taking care of my information and data. So I do not like government stepping in and legislating and telling us how to do our jobs. But if they are not the ones doing it, nobody is going to do it. So let me just give you a couple of examples. Since that bulletin was put out, a couple of really cool things happened. A lot of ad platforms are now putting out APIs that allow you, if you do server-side tag management on a server that's willing to sign a BAA, for example, the Google Cloud platform is willing to sign business associates agreement. Awesome. So LinkedIn just a couple of weeks ago released the LinkedIn CAPI. It's a conversion API. So you can pull all of the information from your ads in so you don't lose any of that conversion information. Google just launched the Google Ads Data Manager, which we highly anticipate will be rolled into the Google Cloud platform, which means it's protected by a BAA. All of these groups are actually doing things now that are protecting patient data, visitor data, right? If you step outside of healthcare, this is a super positive step. They're allowing the marketers and the technology folks to be able to truly control what information is shared versus just thinking we're redacting it or anonymizing it on the platform without actually doing it. And all of this has happened since the bulletin. It is not super expensive to roll out a new solution. Server-side Google Tag Manager on a platform there's a large number of them. So I know I just mentioned Google Cloud Platform, but there's a lot of other ones that are willing to sign a BAA. Really easy solution. You can still use Google Analytics. Don't have to change your processes at all, but it's going through a filter that's protected and protected by a BAA and you're all safe. That's not very expensive. It really isn't. It's not onerous. It's not putting undue pressure on marketers. But you know what is really scary? In the audits that we've been conducting since this bulletin came out, two things that terrify me as a patient. First, one organization we did an audit for had built their web forms in such a way that whenever you submitted an inquiry, all of that form data was put up in a URL parameter, and every single tool or pixel that was put on that website could then capture the person's full name, date of birth, email address, home mailing address, everything was being captured. Terrifying. We have audited and found a lot of systems that have call tracking and they are not implementing a HIPAA safe version. So the entire call is being recorded and shared with all of the agency partners that they've given access to that tool. So, hi, this is Jenny. Yeah, I'm calling a doctor to make an appointment. Yeah, I have this really weird rash that won't go away. Yeah. Oh, yeah. Here's my date of birth. Yeah. When can I get in for an appointment? Yeah. Here's my home mailing address. Those recordings are then available to dozens of people that have access to that platform. Terrifying as a patient. I don't want my personal information shared with Joe from Rando IT company. And I'm sure you don't either. And then also, again, TikTok tags being on some very providers that we hold in such high regard as far as the types of care that they provide. And they're sharing all of this information with Meta and TikTok and all of these other organizations. American Hospital Association, I appreciate that you're trying to reduce the administrative burden, you're trying to reduce cost, but this is not a hill that's hard to climb. This is in the patient's best interest. As a patient, I want this to become standardized. And for all of the audits and implementations we have done, it's not that expensive. It is not that hard. You have to understand technology, but it's absolutely doable. And if healthcare has to implement this, so that way the rest and all of the other industries end up protecting consumer privacy as much as we should be protecting patient privacy, I consider that a win. So would I rather see our client budgets going toward more marketing campaigns for the little budget that has to be done to redo all of their analytics tech stacks? Of course. every dollar that we could eke out to help patients, the marketing budget to help them find better care, buy a health insurance plan that gives them the coverage that they need, whatever it may be. I would always prefer that be done. But if we have to sacrifice a small little bit of budget in 2023 and 2024 in order to make sure that patient information is correctly stored, you bet that's the right call. And I really hope that American Hospital Association changes their position. And I, for one, do hope that OCR does not change their position. And instead, we end up being the bright, shining light that other industries begin following because we paved the way to make sure that individuals' information is safe. So with that, thank you for tuning in. And I hope to see you on a future episode of We Are Marketing Happy. If you agree or disagree, whatever it is, catch me on LinkedIn, share your comments and thoughts in the chat. I'd love to hear from y'all. Have a great day.